We need to stand on that highest mountain we have here on Guam and shout. We're going to do that.
Committee Chair on Health Senator Dennis Rodriguez Jr. is talking about the Patient Protection and Affordable Care Act. He, along with Vice Speaker B.J. Cruz and Senator Chris Duenas, have introduced Resolution 316, which is a compilation of concerns raised during several roundtable discussions with stakeholders.
There are certain provisions that have already kicked in and have been in place here in our island, and there's also a lot of challenges that we face.
Challenges such as the implementation of a health care exchange system. Guam had to opt out because for the first year alone, it would cost $74 million, far in excess of the $24 million six-year allocation that the territory was slated to receive under the federal law. According to Department of Revenue and Taxation Regulatory Program Administrator John Carlos, that's just one of the many inequities mandated in Obamacare.
There should be more provisions of the Affordable Care Act that should be made applicable to Guam, particularly in terms of individual mandate, employer mandate, and subsidy.
Calvo's Select Care Plan Administrator Frank Campillo testified in support of the resolution and hopes the legislature will pass it swiftly. He informed senators that meetings are planned in the nation's capital at the end of the month, during which the impact of Obamacare to the territories is expected to be discussed. Guam Surgery Center Administrator Melissa Weibel commended senators for introducing the resolution.
Unfortunately, oftentimes the territories, and Guam is obviously one of those, are forgotten whenever they're putting together programs and policy, but yet they include us in its efficacy, and it causes great problems and great distress for those territories.
Senator Rodriguez said he would work to get the resolution passed before the end of the month. It will then be forwarded to Congresswoman Madeline Bordallo.